Welcome back. To bring you an inside look at what's happening at the Capitol this week, we turn to our On Politics panel. Tim Graves is the president and CEO of the Texas Healthcare Association. His organization works directly for the betterment of long-term care patients. It also offers professional support for those working in that field. Dr. Bruce Malone is the president-elect of the Texas Medical Association. He's also an orthopedic surgeon here in Austin, and his organization represents 45,000 doctors and students statewide. That's the largest medical society in the nation. And John Caliandra is the executive director of the Texas Conservative Coalition. He founded the group in 1985, working with lawmakers to shape public policy with a conservative vision for state government. Good morning, gentlemen.
Good morning. Good morning.
Hey, I've got a question. Can you talk to us a little bit about what's going on right now with the health care cuts? We were talking about 33% to Medicaid, possibly.
Absolutely. The situation with the House bill and the Senate bill, both the budget bills that have been introduced, have significant cuts for health care. The folks that I work for, of course, mainly nursing homes in Texas, we're looking at a 33% reduction in the Medicaid revenue, which is the largest share of the revenue we have. Our Medicaid census in the average nursing home is about 70%. So there's no way we can take that kind of cut without significant problems across the state.
Mm-hmm. And Bruce, polls suggest a lot of us don't like Obamacare, but it doesn't seem like we're really hitting the marks on high-quality health care in Texas, whether you're a hospital or a doctor or a consumer. From your perspective, knowing those are all different, how do you fix the problem?
Well, if you're referring to the Medicaid cuts, that won't help. Only 42% of our doctors currently in the state of Texas take Medicaid. And the problem is the payment for providing the service is less than the fixed costs for providing the service. So it's a big issue. And the thing I'm concerned about most about the cuts are not my practice in Austin, Texas, but the family practitioners and pediatricians in South Texas who may have a 70% Medicaid patient population.
Mm-hmm. And John, I'm going to take a question from one of the people on our chat this morning. We heard Attorney General Abbott say that more doctors will be getting out of the business if Obamacare continues. What do you have to say about that?
I think the Attorney General is absolutely right. The essence of Obamacare goes in the absolutely wrong direction by cutting Medicare reimbursement, number one. Number two, by not permitting states to have program flexibility, to institute sensible policies around which we can provide and deliver health care to the people of the state of Texas. So I think the Attorney General has hit on the central challenge right now, which is winning that lawsuit and continuing to press the federal government for program flexibility.
Now, the governor has suggested we could do a better job of health care. I want to know each of your perspectives on how we fix Medicaid, even if it's fixable.
Well, that's a big question. I think a lot of the things that we have to do are prescribed either through federal or state regulations and statutes. Commissioner Cease, the Commissioner of Health and Human Services, has talked quite a bit about if we could obtain more flexibility in terms of how the state goes about structuring its programs, that would be helpful. The other solutions, I'm afraid, I know the budget's in the tank, but we have got to think about ways of either moving money through different ways to different parts of the budget, or talk about revenue. If it's not raining, I don't know what's happening. I think we need to use part of the rainy day fund. We may need to think of other revenue measures. I know that's not popular, but times are grim. If that budget goes through the way it is today in the Texas budget, you'd have significant nursing home closures, loss of jobs. Impact on patients, of course, is the main concern. But we're talking about significant changes in local communities in terms of jobs base and things like that. So there are no easy answers.
With so many professionals in your organization, Bruce, I mean, is that a worry for you as well?
Absolutely. It makes no sense to create insurance programs that no doctor can afford to take. Right now, we're doing our civic duty and trying with CHIP and with Medicaid to support our community. We know that under the new federal legislation, there's going to be a rapid expansion of Medicaid in Texas. We're concerned about primary care base, but the crucial way to save money is to have a medical home for these patients somebody they can depend on, decreasing emergency room visits, and then just changing the individual choices of lifestyle and the health issues that they choose to ignore.
John, Tim mentioned something about the rainy day fund. I know conservatives have been very hesitant to tap into that. What do you think?
I think we could balance the budget without raising taxes and by preserving the rainy day fund for future years. The primary concern that we have isn't just about the budget that we're dealing with right now, but because of the rapid expansion of Medicaid under Obamacare when it goes into full effect in 2014, we had better ensure that we have reserves in the bank to deal with the expansion of Medicaid when that comes down the pike. So this is why we're very concerned about tapping rainy day fund for the next biennium.
And also, I know that your group did come out with a budget blueprint a few weeks back. Do you think there is any wiggle room for Health and Human Services?
There's a little bit of wiggle room. Let me say, just as a matter of principle, I agree very much with Dr. Malone that we have to have a focus on our primary care physicians. So we looked at alternatives to save money in human services that I think gets us down the path of fundamental reform without touching the primary care physician. As an example, we believe that the managed care should be expanded in 3 South Texas counties where there's about 2% of the state's general population and yet 10% of the state's Medicaid population. That would net us a savings of about $600 million a year. So that's one thing. Number two, and I think we're very much in agreement with TMA on the issue of getting program flexibility so that we can consolidate funding streams. So we're diverting funding currently away from care into hospital construction. And I think we need to get those dollars that are getting to us from the federal government into primary care. So I think those are 2 fundamental things that we ought to do.
And Tim, after the House budget came out, we did a story here at KXAN about nursing home cuts and what might happen with them. I know a lot of the workers in nursing homes we talked with were worried about those Medicaid patients. Some said they might even end up on the streets because they don't have anyone else.
Well, you know, we don't like to cry wolf, but I do think there's pieces of the sky that are falling if that budget proceeds as it is. And like I said, our main concern is the patients, the residents who live in the nursing homes. And those folks today are older and sicker than they were 10 years ago. We have a lot of community-based programs in Texas which do very good programs that keep folks at home longer, and that's where everybody wants to be. But the folks that are now in the Texas nursing homes, I'm really not sure where they would go. A lot of them would end up in the ER, which is absolute wrong place to be. A lot of their families have disintegrated. That's one of the reasons they're in the nursing home. So I don't see any good end game on this.
All right. And what do you think?
Well, I think the nursing home viability in the state of Texas is crucial. Number one of the things they do is serve as a transition between the acute care hospital and home. That's not a Medicaid program, but a Medicare program for about 21 days. That's an important program that has to be maintained, and I think so far that will be. But cuts were started in that last year. And then, of course, we know that the Medicaid program, we know about obstetrics and we know about children, but the vast majority of the funds are spent for the chronically ill and elderly.
All right, well, I know you have more to say. We'll take a short break and be back right here on our On Politics panel here on Session 11. Stay with us.